at the last segment, driving home the importance of heart health. Poor circulation can cause many health problems, but good health habits can counteract them. Another reason to promote healthy activity is to prevent blood clots, a gel-like mass that forms to repair damage to a blood vessel, but they can cause harm as well. Clots can obstruct blood flow, resulting in poor circulation, and if they become dislodged, they can travel to other parts of the body, causing bigger problems. Dr. Charlie Hahn of Veins, Florida tells us the signs to look for.
Usually you tend to notice the leg feel heavy, and there's a lot of swelling. And sometimes patient can have fatigue, and that can be caused by the blood clots that are traveling from the leg to the lungs, and which is, happened to Williams, the famous tennis player. She developed blood clots in the leg, which she didn't know. I think she had lots of fatigue and shortness of breath. That's how they find out she has blood clots. They tend to develop blood clots because there's less blood flow. When you sit for a long time, you kink off those veins in the pelvis, and then the muscle doesn't move as much, so it doesn't pump the blood back into your system. But they tend to develop blood clots, and they do not tend to develop varicose veins. I would suggest they can take some aspirin as prophylaxis if you're medically able, and also try to get up and move around. As long as you move around, the leg muscle, they're pumping, and they will sort of like acting a muscle pump. They pump the blood and back and forth, and that will decrease the chance of blood clots. Ablation process means we destroy the vein that has the valve problem. We can use different energy source, most popular laser, and also microwave. And these are minimal invasive. We place the device into the vein, which is usually the saphenous vein. They have leakage of the valve that causes those varicose veins. And when inside the vein, the device will heat up. It's either by microwave or by laser, and then will damage the lining of the varicose veins, and then will make it shrink and eventually go away. We prevent the blood flow, excessive blood flow, from coming back to reach those varicose veins. The blood flow used to be back up in the vein would now be rerouted to the deeper vein, which will be back to the system. With ultrasound guidance, it's usually only about the 1 needle incision, and it has minimal blood loss and really minimal pain and post-operative recovery time. The stripping of the saphenous vein is on its way out. Not a lot of people do it. It's such a traumatic experience, and the patient can bleed a lot. For our new ablation procedure, even for microphlebectomy, it takes really minimal sedation. It takes a very short period of time to do, usually about 30 minutes, 40 minutes. Patient go home same day, 30 minutes, an hour after surgery. Really not much pain after surgery, and all the incisions are very small, very minuscule, and heal very nicely. And it can eliminate almost all those unsightly veins and swelling and pain patient experience. So I think it does really help patients a lot. From the procedure and the post-op recovery, and also amount of pain they experience during the procedure, after procedure. It is really much dramatic improvement.
If you'd like more information on this story or contact information for Veins, Florida, just click on the Stand Up to Clots story link icon on our homepage at yourhometownhealth.com.